Dr. Elias Morgan had worked at St. Gertrude's Hospital for 15 years. He'd seen his fair share of midnight shifts, emergency calls, and death. But there was something about that night, something he couldn't name, that felt heavier than the rest. It was close to midnight when he was asked to retrieve supplies from the basement, an old, echoing place that nurses whispered about during night rounds. Most of it was superstition, stories passed around to keep things interesting in a hospital that was far too quiet after 10 p.m. The rule was simple. Patients could walk the halls to stretch their legs, but they were expected back in their rooms before curfew. Anyone wandering after that? Well, security usually handled it. Usually. Dr. Morgan stepped into the elevator and was mildly surprised to find a woman already inside. She looked to be in her early 40s, pale but alert, staring straight ahead at the closed doors. She wore a standard hospital gown and gripped her hands tightly in front of her. "Good evening," he said politely, pressing the button to the basement. She didn't respond, nor had she pressed a button herself. He frowned slightly. Why didn't she choose a floor? But he shook off the thought. Maybe she was just confused. Long-term patients often were. The ride down was slow, humming with the weight of silence. When the elevator reached the basement, the doors opened with a mechanical groan. Beyond the threshold, the corridor yawned in dim, flickering light. At the far end, a figure emerged, a man limping toward them with an unsteady gait. Dr. Morgan's breath caught in his throat. The man's hospital gown hung loose, stained, and on his wrist, glinting beneath the fluorescent lights, was a red band. "No," Morgan whispered. "He died. He died last night. I did his surgery. He didn't make it." Without thinking, he slammed the close door button, jamming it repeatedly as the man drew closer. The doors creaked shut just as the figure reached them. For a moment, Morgan was sure he saw the dead man smile. The elevator began its ascent. The silence returned. The woman beside him turned, visibly annoyed. "Why did you do that?" she asked, her voice calm but clipped. "He was trying to use the lift." Dr. Morgan turned to her, trying to suppress the tremble in his hands. "Did you see his wrist?" he asked. It was red. He was dead. Then she raised her hand. Red band, like fresh blood against ghostly skin. "Like this one?" she said with a smile too wide, too still. And in that moment, Dr. Elias Morgan realized the mistake wasn't in letting the dead man approach. It was in ever getting into the elevator at all.